the world, we say thank God it's Friday. Yes, it is Friday, that time of the week when the Lord has given us the privilege to be together, to be able to learn from one another and to listen to what each one of us has to say. And tonight, I'm privileged once again to have Dr. Magdy with me from Forest Park Hospital. Good evening, Doc.
Good evening.
How are you today?
I'm okay.
By popular request, we had so many questions last time, we couldn't finish them. And because it's a series that we are doing, remember last time we came, we did an introduction. So in case of those who were not able to hear what you had to say last time, can you introduce yourself? And then we'll then do a summary of what we are talking about in the series, and then before we go on to today's topic.
Sure.
Yeah. Who are you? Where are you coming from? Because there might be some new people.
Dr. Magdy Elsharkawy. I'm an Egyptian doctor and working in Zambia since 2011. And now I'm working in Forest Park Specialized Hospital. Last week we was talking about the new services, medical services, which now is available here in Zambia. The first one is PRP, platelets-rich plasma. The second topic is laparoscopic surgery. The third one is management of the hemorrhoid by ligature. So last week, the week before last week, we was talking about PRP. We can just refresh the information about PRP.
Yes,
so PRP means platelets-rich plasma, which is indicated in treatment of erectile dysfunction. We can use it in cosmetology. We use it in chronic ulcer. We use it in...
That is, you have a chronic wound
yes, chronic
anywhere on your body.
Yes,
yeah, it's not the ulcer of the stomach.
No, ulcer in the skin. Chronic skin ulcer. We can use it in chronic skin ulcer to initiate and the healing process. Also, we use it in the chronic osteoarthritis. Instead, the patient goes to the knee replacement. This is injected intra-articularly by the CT guide.
Okay, so you use a CT scan to inject into
the intra-articular in case of the cartilage is still present. Sometimes the cartilage is calcified and at this point no PRP not working. But if there is a cartilage and this cartilage is little bit atrophied, we can inject PRP and this helps regeneration of the cartilage and the patient not need to go to knee replacement surgery. For first indication of PRP, which is erectile dysfunction, because a lot of patients asked me last week, is it operation? No, it is not operation. Just we take blood from the patient, we extract this PRP, which is platelets-rich plasma, and we re-inject it in the penis, just by small 20 needles, very small needles. So there is no pain. The patient can feel improvement within 2-3 weeks, but even in the same day he can have a sex, no problem. So today we will talk about the second service which is available here in Zambia, which is laparoscopic surgery. What is laparoscopic surgery?
Just one or two things that have just crossed my mind though. I think you should let the viewers know that there is no age limit, and it is something that you can do there and then without having to operate on any other part of your body.
Which in PRP?
In the erectile dysfunction.
No, PRP is very simple. We just take blood from the patient, and this blood we send it to the PRP lab, just make some processes, and get the platelets-rich plasma, and we re-inject it. But the process should be done under complete aseptic technique. So the patient is remove all his clothes and wear gowns and go to the main theater. Even me, I go scrub and go as if I will do operation. But it's not operation, just we inject this PRP in the penis. Okay, and this is help the tissue renewal and regeneration of the tissue, which is responsible about erection. There is no operation. The patient stay in the hospital all the time from come to go, just 2 hours.
So in other words, this is something that can help to save a lot of marriages, according to some of the, the questions that we have here. When someone sent a message to say that, what can I do? Please help, because my wife is about to walk out because she says I'm not performing well. So
very safe, it's very safe, it's effective, no allergy, no side effect, nothing at all.
And when you consider the amount of drugs that they may need to take compared to this minor procedure, I guess it is much better for them
any drug used to help the erection, just work after 2 hours and just have a limit to its time to work from 12 to 24 hours. The maximum one can work for 36 hours, but PRPs work anytime.
Okay.
No limitation, it can work from 6 months up to 1.5 years.
Right. So if viewers, if you want to participate, you have any question or any contribution, please send your SMSs on 0978 437 437. 0978 437 437. Today we are going to talk about another indication of PRP. We now know that it can be used for erectile dysfunction. Now we're going to talk about the second indication, which is for laparoscopy. And so,
today we want to talk about the second topic, or we continue talking about
the
PRP,
the same PRP,
cosmetology.
Okay, PRP and cosmetology. Also, because you see there are about four. Yeah, I think there are about four different types of indications.
Yes.
Yeah, so let's go to the one for all beautiful women. Talk to us about cosmetology.
Okay, cosmetology. PRP is safe in case of cosmetology. We can use PRP. We can use PRP on a lot of issues indicated, especially in cosmetology. Number one, in old age has some shrinkage down to the eyes.
The wrinkles are appearing.
Wrinkles down to the eyes, and these deep lines around
the neck,
and the chest. Yes,
right.
This can be injected by PRP, which is much better than to go to inject. I don't like to mention the names of others.
Yes.
Okay, but PRP can give good result in this. Also the same in erectile dysfunction. There is no reaction, there is no complication, there is no any side effect, safe 100%.
Right.
Also, we use what's called dermapen. Dermapen.
Prof, we are women. I have to stop you here because you're talking about something that not only the women can benefit, but the men as well.
Yes.
Right. So you will. Just sorry to delay you a bit on the cosmetic aspect. We normally like to apply a lot of creams on our faces. We like to be young. Sometimes we even overbleach ourselves. And some people, their skin gets dark, get burnt.
Yes, you are right.
When they go onto the sun causes a problem. And most of us have to use makeup to camouflage that problem on our face.
Yes.
You've just mentioned that it is useful for removing wrinkles from all over. So it's not only something for women, even men who want to still looking young.
Yes.
So now this...
but the woman is more interested.
But we are more concerned because we want to look beautiful. And you see, women, there's this thing we used to say, Coca-Cola and Fanta faces, where some parts are fair, other parts are dark. So how can a woman who may be listening, who has actually done some harm with the chemicals on her skin, how can she benefit before we go to the Ben?
Okay, this is just we inject this PRP by the same tiny needles in this wrinkles and these deep lines, and it is improved within 2-3 weeks. It gives good result after the injection. Also, some women and even men has scar, old scar. We can also use what's called dermapen.
Okay.
Dermapen is just microneedle. Microneedle makes small hole, very small hole. It is faster than laser.
Okay.
So after we finish from make these holes, we apply what's called the BBB. After we separate the platelets rich plasma, The remaining amount of plasma is called poor platelets plasma.
Okay.
So this is also can be injected, be useful for the patient. We can use this dermapen to make this micro holes in the face and make massage by this PPP, so the face will be shiny and healthy, look more healthy.
So those holes, just for those who are scared of needles, they are very tiny, so that they actually cannot be seen after you've done the procedure. This
is a special machine, worked by very faster. Just make even the needle is just disposable needle. Every patient has its own needle, and we apply this needle for all the skin of the face to make this. Nobody can see this hole by naked eye.
Okay.
You can't see it by naked eye. So after we make these holes by dermapen, we can apply PPP to the face, the skin of the face, more healthy, more come to shiny, and you don't need for these creams and cosmetics creams that you put on your face.
Okay. A lot of people are talking about Botox now. Can you explain the difference? I'm sure there's a difference between this and Botox.
Botox, whatever the Botox, I don't talk about anything, but whatever the PRP from the patient himself. Other medicals, other component, other chemical, it is different than the body natural. And maybe it has reaction, maybe it is alert, I know, but maybe, nobody know. There is nothing 100%. Maybe the patient has reaction, maybe the patient has side effect, has problem. But with PRP, there is no any side effect. This is the best advantage of PRP. There is no reaction, there is no side effect, no allergy. It is safe 100% because from the patient to the patient. Even I call it auto management.
Okay, so you use your. I'm sorry, we've been having a number of calls. For those who just tuned in, please don't call on the mobile phone. You can only receive your SMS. Send us a text. I'm sure you'd like to participate. I'm sure you have questions. I thank you for the efforts that you've been doing in trying to call, but we cannot access your call. Would rather you send us your SMS. So the number is 0978 437 437. 0978 437 437. Thank you very much for your response, and thank you very much for listening. So Doc, maybe we could try to let the viewers go through the process with you. When the person comes, is it painful? You said they are damaged. I want you to overemphasize that, because a lot of people, a lot of men especially, are scared of injection. I'm sorry to say. When you hear of needle, even today somebody was telling me that no, that's one thing, I don't want injection. No, I don't want injection. Can you go through the procedure for the ordinary man who's listening? Let them know it's not something that is painful.
For cosmetology, we use cream, which is like make anesthesia on the face. We apply it on the face, and we don't start the process of dermapen or the injection of BRB until after half an hour. So this cream makes the surface of the skin like paralyzed. Yes. So that he never ever feel any pain. Even in those patients with erectile dysfunction, before we inject, in some people which is scared from injection, we apply the same cream. We make anesthesia of the surface, like local anesthesia. We put it on the skin, and after this he didn't feel any pain during the injection.
Right, and any blood loss?
There is no blood. Just all we take from the patient for erectile dysfunction around 25-30 ml of blood to extract the amount of PRP we need to inject it. But in case of wrinkles, the amount is decreased. Maybe in the case of wrinkles, because in the face it just need a small amount, just maybe 10 ml is enough.
All right. What about any contraindication? People with diabetes or blood pressure or any other condition, HIV or whatever? Are there any exemptions? Can anybody apply? Or do I have to be helped in certain conditions?
I said we take the blood from the patient to the patient. When the patient condition be more healthy, the effect of PRP will much better than the one which is not healthy. This is a fact. Okay, but there is no contraindication, there is no side effect, there is no any problem.
Right. So for those, for you viewers who are listening to us, watching us today, know that there is no contraindication, no color, no creed, no whatever, but you may be worried about, no health reasons. Anyone can come, anyone can participate, anyone can access, and anyone can look nice and young again just by having this particular procedure done. And when the patient comes, you said it's only takes a few hours. And, then they go home. There's no admission.
No admission. No. Just maximum 2 hours in the hospital.
And do they need to be driven? Because sometimes some people do a bit of procedure and they'll say, come with somebody to drive you home. So if I come, if I want to look young and I come to you, I can always drive myself.
This PRP don't affect on the conscious level of the so anyone after, even in case of erectile dysfunction, he can drive, he can go home driving. There is
no problem. No. Yeah, there are some questions that have come. Hi Doc, I'm enjoying the show. Can we use the same technique PRP on women sexual dysfunction? If yes, then let's see the continuation. If yes, then how? Okay.
So in
fact, there are several questions here.
Women which has difficult to reach orgasm, you know what this is? Some woman lost libido. So we can this. We can take also blood from this patient and inject it in the clitoris. So the clitoris, the same, the clitoris is a sensitive part on the female genital organ. Okay, so this is also increase the desire and the feeling of orgasm.
Okay. Now I hope the husband won't get into trouble because of that. Okay, so she's saying the same technique can be used on women as well. So any woman with sexual dysfunction, it's not only for men with erectile dysfunction. The women can also have an opportunity to make use of what is available. But there was another one which had come earlier which said, Doc, what causes erectile dysfunction? I need help. Where are you found?
So we come back to erectile dysfunction. The cause of erectile dysfunction, there is systemic causes and local causes. If we talk about systemic causes, diabetes mellitus, hypertension, generalized weakness, whatever the cause of this generalized weakness, all of this lead to erectile dysfunction. Local cause, maybe exhaustion and atrophy of the tissue which is responsible about the erection, especially in old age. This is erectile dysfunction don't appear in 20, 30, even up to 40 years. There is no problems. But after this, this is exhaustion of this tissue. This is need to regeneration and rebuilding by injection of PRP.
So now, how do you use the technique on women? Because you mentioned that
we inject
into the vein.
The same way we take some blood from the woman and we prepare it and extract PRP and inject it in clitoris. Also we applied some local cream anesthesia and inject it in the clitoris, which improve her libido and can get orgasm.
So what the person, there's another one wants to know where you can be found. They need help, so we'll give your telephone number at the end of the...
No problem. If they can put my telephone number on the screen.
Okay. And then the next, there's another question which came. All right. whilst I'm trying to. And okay, if you use it on a woman, how long does she need to stay away from sex?
No, she can.
How long?
Even for men and women, this can be in the same night, but the good improvement after 2-3 weeks.
Okay, so it's the same, because last week you said the man can actually have a relationship that day, but by 2 to 3 weeks it gets better.
Yes.
So it's the same thing that that happens to the women. Okay. Good evening, doctor. If someone has a small manhood and weak, can it be satisfying a woman, or it cannot perform? If someone has small manhood and weak, can it be satisfying a woman, or it cannot perform? And if a lady is 40 to 45, can she attend the period from Peter in New Kasama, Lusaka? So he wants to know that his private part is small and weak. So how can you use it to satisfy a woman?
No, the size. This is this is good chance to talk about the size of the penis for the woman. This is the normal size which can satisfy any woman, so just from 6 mil to 11, 12. Because you know after even in the vagina, the sensitive part is the distance. After this there is no sensation. So in the vagina itself, the sensitive part from 6 mil up to maximum 10, 11. So if the penis size is just from 6 up to 14, it is more enough to make the woman satisfied. But this is this old information that is the size. This is wrong. It's wrong. This culture is
cultural thing. So because some people think that the size matters. Actually, what is important is how it is used. That's what's more important than the size. And that I suppose I've had a lot of.
But the weakness can be managed by PRP.
So the weakness can be managed, right? And then if the woman is 40 to 45,
the age is not. There is no restrictions by the age group. I said I did it for one man. He is 76 years old, and he is enjoyed. He reviewed me last week, and he is very happy.
Okay. Another one says, "Hi doctor, enjoying the program. How many times is recommended for an average man to have sex in a week?"
This is depend on the age. Like from 20 years up to 30 years, he can have every night, no problem. From 40 to 50, she just 4 or 5 times per week. From 60 to 70, I think 2 times per week is enough. After 70, just 1 time per week is more than enough.
Okay. And irrespective of whether they have any other medical condition, right?
Yes. You should have good health.
Okay, fine. Please send your SMSs to 0978 437 437. Now the cosmetology, which is the other thing we're talking about today, which is what we have as an indication using PRP. The oldest that you've attended to, I know for the erectile dysfunction, you've attended to a 76-year-old man, but the age, does the age matter? Or does it matter, no matter how old the person is, if they still want to look beautiful?
Yes, any woman has any wrinkles, whatever the age, some people look old age, but actually she's younger.
Yes.
But anyone has just these wrinkles down to the eyes, this deep lines, this unhealthy skin. All of this can be indicated without limited age.
So this is actually much better than going for a face job where they have to the operation where they have to stretch your skin so that you can look a lot. And then it's
much better than surgical interference. I am a surgeon, but I have know that this is much better than surgical interference.
Right. And another thing you mentioned that I want to take you back to is that people with scars, if somebody has had burns,
yes, burns,
and
or
they
a scar,
have an accident or something,
yes,
and they have scars on their on their faces. But what about the rest of the body?
If I have a scar on my hand, some patient ask me she has a scar in abdomen, and she don't like this shape of this scar. Even we buy dermapen and by BBB, the scar will be removed. Just she needs from 6 to 8 sessions, and will be this enough for removal of the scar. It's much better than laser.
So even those who have gone for, in the olden days we used to give the patients very ugly scars, the midline section, and now they are doing the finasteride operation.
And this is what we in next talking we talk about laparoscopic surgery, and which done big surgery without cut all the abdomen or the stomach.
So at least with those women who have those scars, they can actually come if they want to have those scars removed.
Yes.
So it's not just on the face.
Not on the face, but any part of the body.
Right. And burn scars, does it matter how deep those scars are?
Doesn't matter this scar deep or not deep. It doesn't matter because this is just we try to like dissection, make dissection, because this dermapen is faster than laser. Make it maybe around 30,000 holes per second. So very fast. You like to make that the sections and like cut of this scar in many directions, vertical, oblique, and horizontal. So we make this dermapen go through this scar in all directions, horizontal, vertical, and oblique. And at end we put this PBB, which makes a new regeneration of the skin, which is much better and fresh.
Right. Okay, let me just ask you another question here. It says, "Hi doc, kindly guide me on how I can increase libido as a man."
As a man? Yes, he can come for.
It can come for the PRP,
yes.
And that can help because that can help his sexual function.
Yes.
Yes, so that it does not only work for the erectile dysfunction, but it also helps his libido to increase, I suppose.
No. I'm not trying to lie on the people. This libido he should look for what is the cause, because we have to make for him some investigation to find what is the condition of the prostate.
Okay.
Because
he has not given us his age. He just said that to guide him on how he can increase libido. But I suppose also that if it depends on your mood, as the doctor said, what mood are you in? Are you anxious? Are you worried?
Yes.
If you are stressed, obviously you can't have a normal relationship with your wife.
Yes.
And it also depends on what you've gone through during the day. You're exhausted, so you must be in them. Those are simple things without you having to use medicine for them.
And there is no any psychological condition.
So it's much easier if you can try to use what is well, he's actually sent another question. This is more or less the same one. On the same libido. Okay, I think you already answered. There's another one that's coming. Good evening, doctor. Sorry to ask an out-of-topic question. I want to know the major symptoms of HIV. Well, we're talking about cosmetology today, but I'll try and see if because now with this phone, we are not able to send a report to you. But of course, with HIV, just briefly, not to take the time of the program. Sometimes you don't know, and that's why you cannot tell by looking at the person. You need to go and have yourself checked. And then before, people used to lose a lot of weight very fast. There were those chronic diarrhea and all those conditions which we used to have in the past, where you could look at somebody losing weight and you say this is it. These days you find people who are very healthy you know, and they're still looking good, even fatter than me, and they're HIV positive. But I said that's another topic, so I will try and see if we can answer to you later. Let's just try and answer the topics that the doctor has come with to help to educate us, because I think it's a learning process for a lot of people. Now, this another one says these people who do masturbation can they produce and make a baby, or what? And what could be the problem? Those people who do masturbation and do they marry or no?
This is what this is. If you remember, I mentioned what's the cause of the one asked what's the cause of erectile dysfunctions.
Right.
This is masturbation is one of the cause which lead to exhaustion of the tissue which is responsible about erection.
So in other words,
the one we do this, when he repeated it, he may at the end, in young age, he will suffering from erectile dysfunction.
Well, that is true, because I remember there was a question. One lady called me once on radio, and she was saying that her husband is a jack because he masturbates, and she was thinking of because once you masturbate, you find it difficult to have a relationship with a woman, because you are so used to having self-gratification. So it's much better for you not to attempt. And, and they were saying that because someone had advised them that instead of sleeping with women, they should masturbate. That's so that they don't get HIV. I'm afraid I think that was a wrong advice. That was given. Yeah. So the thing is that one should understand that you have to take time to look after yourself. I mean, if these things are available here, if you have to buy a ticket and go abroad for you to look after, to change your skin, to get any of this treatment that we are talking about, it's going to cost you a lot much more than if you are having them done here. So the whole point of having this program and these topics and this series is just to educate you, so that you know that there is light at the end of the tunnel. Don't think that, okay, I'm like this. Marriages are breaking. You know, for over the years as I do work in the media, there are always questions about
this. This is of course we are here just to let the people know that this medical service is available now in Zambia.
So they should have access to it without fear of favor. And then understand that it is for your own good, and don't think about the fact that it's only for some people and not for you. The cost, we will not go into details because we don't want to advertise, but I can assure you it's a lot cheaper than if you buy the tickets and going to any of the nearest.
No, also I can add it so that the price is less than if he buy drugs and use it every night. The total is much better, because the drug has a limit time and limit duration.
What about a child who is burnt? Is it safe for you to use the same technique so that when they are older, they will not have any form of deformity?
Like what?
The burns. If a child is burnt.
Then
now,
yes, also.
Can you use it on a child who is burnt?
Yes, of course, because this also depends on the size of the burns. Okay, if there is this burn is just small burns and make small scars, but in huge scars, maybe he change. But I don't know. I can't promise that it will become to normal skin. But
because the children's skin is very sensitive.
The skin and the regeneration of the skin is much better than in old. But if he has small scars, we can try with him. Right? Okay. I think it will give good results. But this is not like what you know in big scars. Is surgical in this case can be faster than dermapen, because you know in big scar of burns, there is what's called implantation of balloon under the skin. This is surgical. We could put implantation under the normal skin, which is close the scar part. And this balloon, we inject this balloon every day by normal saline. So the skin become like the patient has lipoma.
Okay.
We will increase the size of the skin which is close to the burn area, and when we have enough skin, we remove the burn and stretch the skin which we by balloon and to cover this area,
The area
which is more big. Because this scar, I don't think so can give result by dermapen.
Okay. Okay. Well, I hope.
So anyone, we after consultation, I can advise him what is best for him.
Right. I think I will be able to give them the information. Thanks. My last question is: since I married my wife, I've never had more than one round of sex with my wife in a night. I hear others talk of 2 or 3 rounds of sex in one night. Am I okay health-wise? Because once I release, and I'm left powerless and empty because I release all the semen.
Oh, this is, he should let us how old is he, and we I mentioned the normal rate of sex. I say from 20 to 30 years he can have sex every night, and it decreased by the increase of the age.
Because some people think, this is a question that is commonly asked, they think that their friends say that I go every 4 or 5 times a night, and I don't even know that some of them are actually telling the truth, though.
Yes,
because
yes,
when they meet in the pub and they're having a drink, they just want to start saying things, and the other person feels inferior complex. But I don't think that some of those comments are correct.
Actually, I agree with you.
Yeah.
But if you have one and you enjoy yourself and you enjoy your wife, that's enough.
That's yes. But I know for a fact that I sympathize with him. But I know for a fact that this is a big question. I've actually been asked when I go out to give talks. So it is a problem that's affecting people, and I'm happy that you are here to answer the question. For those of you who have been listening, you have an opportunity to send an SMS on 0978 437 437 0978 437. Please don't call because I will not be able to take your calls. But if you send an SMS, whether it's a contribution or a question, I promise as long as it's on the topic, we are going to be able to answer the question that you have sent. I've got 2 more questions, but they are more or less just thanking you for the education and thanking you for they are enjoying the show. So that's it. Enjoying the show. I'm enjoying the show. Yeah. Okay. Those are not questions, just comments. So you seem to be touching the heart of the people who are listening. And then we want to let the people know that there is a danger in them using chemicals on their skin. So what it means that once they have already gone through the dermapen, the treatment, what sort of care should they take on their skin afterwards? It means they cannot use any other chemical, right?
He will see that is by this dermapen and PRP and PRP and BPP, the woman or the man will feel much their skin will much better than before. So he or she doesn't need to use more chemicals.
So in other words, there is no. And how long for the erectile dysfunction? You said for about 1.5 years they will have no problem.
I think for the skin more than this.
More than that, yes. So they don't need to come and do it. And another question says, doctor, how do they count rounds? Is it minutes or hours? I have no much idea. Help me.
This round is difference from it depends both partners, the male and female, and how long it taken. You can't put a specific time because maybe one can reach orgasm faster than others. We don't like to put times because this may be not true, and maybe some people is different and affect other people. So this is sexual relationship. Both of them should be happy. That's it. When both of them are happy, finish.
Right. So in other words, they should be relaxed, and they're supposed to be in the right mood, not one-sided. It's something that has to work for all those. And I agree with you, because it's saying how many minutes or hours.
No,
somebody surely cannot take hours to have a relationship with the partner and end up dying of exhaustion.
Well, it is not a mechanical processes.
It's very interesting questions. Okay, anyway, thank you very much for every question that you've sent. Actually, you're going to send. It's very important. Don't forget, it's 0978-437-437. We value every question. The only question which is foolish or whatever you may look at it is the one that you have not asked. As I always say whenever I give presentations, because you end up going with the wrong information, and that's not going to help you. Now, another one has come and said, my manhood pains each time I'm urinating. Please advise. Every time he goes to pass urine, he has pain.
Pain. So this should go to the urologist to make some investigation about his urinary tract processes. We should go through this investigation to find out what is the cause of increase this frequency and what's the cause of pain during dictation.
That's a very good report. They should not be having pain, so you've been advised, go and see your doctor.
Yes.
So 1978-437-437, send your SMSs, and let us see how best we can assist you. And let's go back to cosmetology, though. The important thing is that the fear. Do they need to make an appointment? How can they access you? We will give your telephone number at the end. But how do they access you?
So the best.
Do you need an appointment? Do they need to be referred to you, or what?
The best, you should call me on the phone, we'll put on the screen, and he explained to me a conversation with anyone, and explained to me his condition, and I have to be honest with him if he could benefit from this service or not. I don't think people just travel from long place to come to my place, and at the end of the day didn't take any benefit from this medical services. First of all, he can call me, even anyone send to me a SMS message, I can answer him and give him an appointment to come to see me.
Okay, in fact we can also, in case they don't have any pens or papers to write, you can also leave the telephone number.
Yes, I leave my telephone number here in the channel, yes.
I'm 36 years old. Sorry, I didn't get the answer whether I'm okay or not. Otherwise, I enjoy my one round of sex with my wife, only that I failed to give her a second round, which could be for her, because first round is for my pleasure. Oh my goodness. So in other words, I understand, the first round is his one.
If he did first round and the wife not reach orgasm, so he has problem, what's called the pre-ejaculation.
Yes.
This is a problem.
Yes.
This also has to be sorted out. This is due to weakness, and he become weak. The organs become weak, so he can't reach her orgasm. But if he just satisfied himself, he has a problem. The problem should be sorted out.
So can he access PRP for the same?
He should be honest with us. Just he become pre-ejaculation, premature ejaculation, or he become weak, because this has its own treatment.
Yes.
The treatment is different.
Yeah, the treatment is different from premature ejaculation and erectile dysfunction. Okay, then of course they could always get in touch with you, so that you can help him to know which one of them is the challenge. So 1978-437-437, and please don't call, and we're here to hear from you. And if you have any scar or anything wrong, any wrinkles, and you want to look young again without any deformity, and this is an opportunity for you to listen to what the doctor is saying. And of course, if you have a challenge it's easy. You have a discussion with him.
Yes, yes.
And then
anyone can call me or send a message for me. I reply.
Yeah. So at least from that discussion, then you'll be able to know what is the best form of treatment for you. But don't forget that any scars that you have in any other part of your body can, including if you've had an ugly scar from a cesarean section at childbirth, it's an opportunity for you to have that scar.
Yes, it's also the best also for any patient who has any scar. He can take a photo of this scar and send it to me, and I reply how long, how cost, every information before he comes to me.
Oh, that's great.
Yes, to make it easy for the people, especially people who is not around Lusaka.
Okay. This one is saying, is there a cure for azoospermia?
Come again?
A cure for no sperms. You know, there's some people who have semen, but they don't have any sperms. So it's asking.
No sperm.
Yes.
So on those people, we have to make analysis of the sperm and found out what is the number.
Yeah.
If there is low number of azoria, azoria means there is no sperm at all. But for those people which has small amount, this is something done, but it is not up till now. It is not established. We can inject PRP in the testicle itself, but this one is not recommended up till now. This is under trial. This is under trial. If anyone has low sperm and he won't like a volunteer to go through this test, no problem. Even I can do for him for free. And we check if we get good result by the injection of PRP in the testicles or not.
Okay, that's great for those of you who are listening. Some of you may have challenges, and you need to make sure that your sex life is happy, because if you don't have a healthy relationship, that can actually affect your marriage. And as the person was saying that the wife is about to leave because she's not happy with your performance. So Doc, I want to, before we close, I'd like you to go over what you've just discussed about the cosmetology, and then before, so that you can, for those of anyone who may have just joined started watching, so that they don't miss out on
okay, in cosmetology, just we said that is the PRP and the BBB can help in the regeneration of the skin of the face, or skin of the neck, skin of the front of the chest. This can be regenerated and look more shiny, and also help in the treatment of those wrinkles down to the eyes and deep lines around the mouth. All of this can be managed and give good result by PRP or PPP by using of dermapen, which is micro needling. And this is give good result, much better than use of chemicals, even much better than use of surgical stretch of the skin of the face. Also, in some patient which has old scar due to burns, due to accident in the face or whatever area in the body, we remove it by dermapen, which is much better than laser. Okay,
much better, but also cheaper.
Yes, I think it's cheaper. Yes, I said for any scars, just it need from 6 to 8 sessions by dermapen, and this PPP, you can just come almost normal.
And this is something that is locally available.
Yes, so it's available here.
Down on the cost.
Yes, this dermapen is available with us.
Yeah, so that cuts down on the cost and the accommodation, the transport fee, and even going with the
You can't compare. You can't compare.
Yes. And that's why we want people to know that these things are available in this wonderful nation of Zambia. And all you have to do is to make sure you find the right way to gain access to it. Okay. Another question says, can I have the number of the doctor, please? Okay, most of them are, a number of questions are coming, but they all want to know where to find you. And they all
you can put my phone number on the screen.
at the control room, we'll be able to put it, and then of course we'll also leave your number.
Yes, I leave my number here. You can call the channels and you can get my phone number and my address from the control room.
Okay, and the other one is saying, I need help. Where are you found? I need help. Okay, we should also give the information, and then we can have it available for everybody who needs the access. And for us, this is talking health. We want you to live a successful life. You should be in a situation where you respect and you look after yourself, and you're happy with what the Lord has given to you. And so, Doctor, the people who come to you, we have already said that they don't need an appointment. All they have to do is to call you on the phone, and then you can...
Anyone can call me on the phone, can send the SMS message, and I will reply and give him its own appointment to come to receive these medical services.
Right. Can I have the number? So we'll be able to give you the number, and if you contact Revelation TV, we'll also leave your number with them so that they can always make an access. So before we leave, Doc, what advice would you like to give the people who are watching, those who are in Zambia or wherever they are? What advice would you like to give?
Just before any one of them planning to go outside of Zambia to get these services we are talking about, now everything is available here in Zambia. Like I said, BRB by its 4 indication, laparoscopic surgery is available in Zambia, hemorrhoidectomy by LAPOROSCOPIC, which is available in Zambia. Also, herniorrhaphy, repair of hernia, is available by Nation in Zambia a long time ago. These topics we are talking about, but this is the main topics. If anyone need help in these topics, he can call me, I can help him.
Right, so, Doctor, you're from Forest Park, which is on Nangwenya Road.
Yes.
But what about those people who are outside? Because this station goes to other districts. For those who are outside,
any person outside Lusaka, he just call me, he send me a message, we discuss his condition on phone. If I see that I can help him by this medical service, I give him an appointment to come to visit me.
Okay. So in other words, at least there's nothing like the distance being a challenge. So now we've established the fact that your color, your creed, whether what religion you are doing, and wherever you are staying, this is a treatment which is available to everybody.
Yes.
So all they have to do is to get in touch with you, and then So for those of you who may not have something to write on, we will leave your telephone number. You can still call on. You can still send an SMS on 0978 437 437 to be able to access his telephone number, or you can look in the directory on Forest Park, and you'll be able to find where he is. Thank you. I want to thank you very much, Doc, for coming, for your time, because I think a lot of people are going to be helped, or have been helped already by what we have discussed this evening, and we look forward to you coming at some stage to listen to the other.
No problem. We can continue our meeting to explain more to the patient about this new medical service which is available now in Zambia.
Thank you very much, viewers. It's been a pleasure being with you. Good night and enjoy your weekend.
Yes, good night.